Hello, I'm Ian Scales, you're watching Telecom TV, and we're here at the Internet of Healthcare event where I'm going to be talking to Ajay Bakshi, who is the MD and CEO of Manipal Hospitals. Ajay, welcome to Telecom TV.
Thank you, happy to be here.
Just to kick us off, do you want to tell me what Manipal Hospitals is and what your role is there?
Sure. Manipal Hospitals originated in Manipal University, which is one of the oldest universities in India. It's the largest and the oldest private medical school in India. Started in 1952. For the first 6 decades, it was run as a not-for-profit, and the main university still continues to be run as a not-for-profit as per the laws of India. However, around a decade ago, somewhere in mid-2005, we carved out the for-profit corporate hospital group, which is what I am leading now. And we have 12 owned hospitals and another 6 that we manage for the university. So in total we have around 6,500 beds, nearly 7,000 employees, almost 2,000 doctors. So it's a large organization. It is the most respected hospital network in India, not the largest. It's the 3rd largest by size, but in terms of respect, brand, values, ethics, we are number 1 without any peer in that sense.
And tell me some of the challenges for running a hospital operation in India. What do you have to overcome that maybe other people in the developed world don't have to overcome?
So India is a large country. It's 1.2 billion people, going on to 1.3 very soon. And honestly, at the time of independence, which happened in 1947, there was not much infrastructure. So for the first 6-7 decades after independence, a lot of healthcare infrastructure was in the public health space. I graduated from medical school in early 90s, 91 to be precise. At that time, the private medical sector was just starting to evolve, and some of the larger chains started to develop. So now I lead a private hospital chain, but I cannot ever forget the fact that I'm in India. There's a large population which does not have access to healthcare. There's an equally large population which does not have awareness of what to do. And then of course there is a problem of affordability. So these challenges are very fundamental, and yes, we have made progress, but there are still very sizable challenges compared to any developed country, which was your question. So affordability, access, awareness, all 3 of them remain significant challenges for all of us.
And how have you been able to improve things using technology, IoT technology for instance?
Right. So even before IoT, I would say telecom has penetrated very deeply in India. We have now, I believe, at last count, nearly 900 million cell phones in a population of 1.2 billion. And that has made, that has sort of flattened the information asymmetry. In large cities, we have drivers, we have security guards who come from small villages, but they're talking to their families on these phones. The per minute cost of telephony, of mobile telephony in India is probably the lowest in the world because of these unit economics of large scale, and that has helped spread some awareness. So at least that awareness part of the equation is getting better. Also in the last 2 decades, we have been fortunate. We have grown our GDP upwards of 6-7% on average over the last 15 years. That has improved affordability. So more and more people can now afford to pay for their healthcare. And finally, in terms of physical access, as I said, private hospitals started coming up in a big way around 2 decades ago, and over the last, there was a study done by McKinsey just 6 months ago, which said most of the new hospital beds added in the country have come through private sector. The public sector is not adding any more beds. So there is, I would say, modest improvement in access, not through so much of technology, but through just sheer bricks and mortar build out of hospitals. Coming to your question on IoT, I would say it's still very nascent. It doesn't really exist as of today. Manipal Hospitals is working on it, and I'm sure we'll talk about it as we go down this interview. But right now the mainstay of technology play in India is with voice, SMS, and more smartphone penetration is happening very quickly.
So I suppose the smartphone and the apps involved in the smartphone could give you a platform for IoT as well.
Exactly.
And for some of these medical applications.
Yes, absolutely.
Is that what you're thinking, and are you thinking through to how you might develop that?
Well, it's more than that. Smartphone penetration is a door opener. It's not that we are doing this because of smartphone penetration. Smartphone penetration is allowing us to do this. Why we are exploring IoT, why I am here, is because a lot of technology improvements have happened over the last 5 years, I would say, around the world, in terms of devices that are available to be a part of the IoT ecosystem, and a lot of data analytics, a lot of data transmission technologies have also improved. So, the whole ecosystem seems to be converging and it is coming together. What was not possible 5 years ago when I was talking about mobile healthcare, when I was at McKinsey at that time, and we used to be telling our clients about call centers, we used to be telling them about SMS based reminders. That sounds so antique today, in just within a few years, because of IoT. So, we find IoT to be a very exciting technology, but as said, it's still nascent and we need to do some innovations to make this come to light.
So I read also that you were involved in something called $1 a day healthcare. Could you expand on that for me? Is that an objective, and how attainable would that be?
Sure. So, look, as we have been very enthused by the very dramatic penetration of mobile telephony in India. We had not anticipated this in the late 90s, and that has told us something, that the Indian consumer, even though he is poor, is willing to pay for a cell phone, for example, if it makes his life better, and he is willing to make that trade off. He may be a farmer, he may be a daily wage worker, but if a phone makes his family safer, he will bring out the money for that. So, I think that is one very important learning we have obtained about the Indian society over the last 10-15 years, thanks to the telecom industry. Now, what we have seen is the initial uptake of telephony was with voice, strangely enough with Bollywood ringtones. So, a lot of people like to have Bollywood songs as their ringtone and they pay money for it, and of course, a little bit of messaging. But now we see people asking for more. They are saying, how can they educate the kids better using smartphones? And so, there is a whole space of education which is evolving, very closely linked. How do we educate, how do we improve healthcare? So, the way we think about IoT is as follows. India has a shortage of doctors, and that is not going to get fixed in the next 10 years or 15 years, because we are really, we are half of where we need to be, and it is a large country. So, we probably need to train another 1 million doctors in the next 10 years, and that is not possible. We churn out around 50 to 60,000 doctors a year, and getting 1 million in the next 10 years is pretty much impossible. So, the doctor constraint,
we nick 1,000 or 2 off you as well.
Yes. So a doctor constraint is going to stay, and there is this large population which has phones, but which does not have health care. So, we think IoT could be that bridge where you have cheap devices helping people, even if they are in a village or in a remote location, manage their chronic diseases better. So, in a sense, we are thinking about it to leapfrog the entire healthcare infrastructure built out, which has happened in developed countries, and even developed countries are now struggling with high cost of delivering healthcare. So, we do not want to go down that path, because we know it's where it's going to go. It's going to go to the same story of high cost and unreliable services. So, we are thinking of using IoT as a leapfrogging mechanism to be able to deliver good quality care to our vast population using IoT and some doctor expertise.
And do you see that as an extension of private medical care, or would that be a state-run
Interesting question. It's actually both. The government is also frustrated by its inability to bridge this gap that I was talking about between shortage of doctors and population. So, I find, and I travel a lot, I have a lot of colleagues in other countries, I find Indian government to be more open, more flexible, more even encouraging. They are putting in place public-private partnership mechanisms by which even if the poor can't pay, the government will pay, and we think that's wonderful, because you're talking about $1 a day, even that's a lot of money for the poor. But we are having interesting conversations with some state governments, and in India health is a state subject, not a federal subject. So, state governments are becoming very excited about, say, breast cancer screening, and there is a device which can be, which a very innovative device which can do it far better than mammograms. They are talking about managing say COPD, chronic obstructive pulmonary disease, at home without getting the patient admitted in a hospital. So, the pretty exciting conversations we are having with the government. On the private sector, of course, we are all excited. Some are farther down the path. I would imagine Manipal is a bit more developed, given our background in both understanding the base of the pyramid, given our origins as a not-for-profit, and 3-4 of us in the leadership have pretty good exposure to technology, and we are doctors. So we as doctors can understand how this technology can transform.
That's great. Well, thank you very much, Ajay. That's great.
Sure.
Thank you.
Thank you.